Good morning. Today we'll be starting a discussion on a new topic, that is TM joint disorders. Okay, so let's start. So, what is TMJ or what is the temporomandibular joint? It is basically the only movable joint in the head and neck region. Okay, and it is a type of a gangliomo-arthroidal joint. So, what does that mean? Gangliomo-arthroidal. It is made up of two terms. One is ganglimus, and the second is arthroideo. Now, ganglimus means hinge joint, and hinge joint is any joint that allows movement only in a single plane, that is, it allows just forward and backward movement. And then what is the second term? It is arthroidea. What does arthroidea mean? Arthroidea means a gliding type of joint, that is, it allows movement in all planes in a gliding motion. Okay, now what are the peculiarities of the TMJ? First thing, it is a bilateral diarthrosis. What does that mean? It means that even though we have joints that are present on the left and the right side, compared to the other joints of the body that are like this, that are bilateral, that is, you have the joint in your elbow. Okay, so that joint, even though you have two joints, both the joints work independent of each other, that is, the right elbow works independent of the left elbow. But for the TMJ, both the right and the left joints, they actually function together. So that is the first peculiar feature of the TMJ. The next peculiar feature is that the articular surface of the TMJ is actually covered by fibrocartilage, whereas the articular surface of all the other joints is covered by hyaline cartilage. Also, the TMJ is the only joint in the human body that has a rigid end point closure. So, what does this mean? Any other joint, you can actually move it to, it does not have a closure of the joint that is taking place, right? So the elbow joint, you don't have a point where the bones hit and close and further movement is restricted. Such a thing is not there. But for the TMJ, you have a rigid end point closure. That is basically because of the presence of the teeth. So once the maxillary and the mandibular teeth come in occlusion, that acts as a end point closure for the joint. Okay, now the other peculiar feature is that compared to all the other diarthroidal joints, TMJ is actually the last joint to develop. Okay, so it develops at about 7th week of in utero life. Okay, so these are the peculiar features of the TMJ. Now, what are the components of the temporomandibular joint? So basically there are two main components. One, you have the mandibular component that is formed by the condyle, and then you have the cranial component that is formed by the temporal bone of the cranium. Okay, the temporal bone of the cranium. Then there are various parts within this temporal bone itself. Okay, and of that, the glenoid fossa actually forms the roof of the temporomandibular joint. So coming now, we'll discuss about the components of the temporomandibular joint. So as I told you, you have a mandibular condyle that forms the mandibular component. Then you have the articular surface of the temporal bone that forms the cranial component. Then you have the capsule that is formed by the ligament. Then you have the articular disc that is the most important part of the temporomandibular joint. Then you have various other ligaments, both main ligaments and accessory ligaments. And then you have the muscles. The muscles are also a very important role, play a very important role for any joint, because it's the movement of the muscles that basically helps in the movement of the joint. Now coming to the mandibular condyle. The mandibular condyle is one of the main components of the temporomandibular joint. It is having an ovoid process that is seated on a narrow mandibular neck. So here you can see the neck is actually very narrow, and the condylar head that articulates with the fossa is actually ovoid in shape, and it is larger when compared to the neck. Okay, and this actually forms the articulating surface of the mandible for the temporomandibular joint. It is rounded in all directions, or it is convex in all directions, and its mediolateral width, that is this width, is much more than the anteroposterior width, that is this width. Okay, so in the cross section you have to imagine this width is actually very less compared to the lateromedial width. Okay, so this width is greater. So the condyle, now this is a axial section of a CT. Okay, from this you can assess the condyle. Now this is the condyle. This is the condyle on one side and this is the condyle on the other side. As I told you, the mediolateral dimension is greater than the anteroposterior dimension. So here again you can assess, this is the mediolateral dimension, okay, and this is the anteroposterior dimension. Okay. Now from that you understood that there is a medial and the lateral pole, right? Now the medial pole is actually directed more posteriorly when compared to the lateral pole. That also again you can make out from this. The medial pole is more posterior, whereas the lateral pole is anterior. I hope you all know that this is the lateral surface and this is the medial surface, okay, within the skull. So that is basically about the condyle. And now if you pass a line through this mediolateral aspect of the condyle, and on both the sides, if you extend the line posteriorly, you will see that that line actually meets at a point near the foramen magnum. Okay, so that is again because of the peculiar arrangement of the condyle within the fossa. Okay, now coming to the attachments of the condyle. The condyle has multiple attachments. Okay, it has attachment of the lateral pterygoid muscle. Okay, then it has some attachment to the articular disc, then it has attachments of the joint capsule. Okay, so these are all the structures that get attached to the condyle. So you have the lateral pterygoid muscle, you have the articular disc, and you even have the joint capsule. Now coming to the, so that was the mandibular component of the TM joint. Okay, now we'll discuss about the cranial component of the TM joint. Okay, so what is the cranial component? The cranial component is, or the articular surface of the temporal component of the TMJ. So that is what is seen here. So the thing that you see here, that is actually the articular surface, and it is formed by the inferior aspect of the squamous part of the temporal bone that is anterior to the tympanic plate. So you have the external acoustic meatus here. The red thing that you see is the articular surface. Posterior to that you have the external acoustic meatus. So this articular surface is just anterior to the external acoustic meatus or the tympanic plate. Okay, and this inferior surface actually has three main components. First is the glenoid fossa. The glenoid fossa is where the mandibular condyle attaches. Okay, then that is bounded anteriorly and posteriorly by various structures. Anteriorly you have something known as the articular eminence. Articular eminence is actually the anterior extent of the fossa onto which the condyle glides. That is the articular eminence. And posteriorly you have something known as the post-glenoid process. That forms the posterior extent of the articular fossa. So this is the post-glenoid process, this is the articular eminence, and this is the glenoid fossa. Now this is the inner aspect. When you look from down, how it will look. So you see the depression, that is the glenoid fossa. Anteriorly you can see this is the eminence, and posteriorly you can see the post-glenoid process. Now this articular eminence actually has a button like structure on it. Okay, that is known as the articular tubercle, and it is this articular tubercle that provides attachment to the lateral ligament. Okay, again about that we will be discussing. Now this portion of the TMJ, that is, it forms the roof of the TMJ, right? That is the glenoid fossa. It is actually very thin and it separates the TM joint from the middle cranial fossa. So you know that this is, you have the middle, this is the middle cranial fossa, okay, and this is the joint component. Now in between you have the bone, right? And we can see that this bone is actually very thin. So you can see that bone is actually very thin. So from that you can understand that it is actually not a stress bearing part of this articulation. Okay, so from that again, some another thing that you can understand is it is the main stress bearing components of this joint are the muscles, but the bone being thin actually does not act as a stress bearing component for the articulation. Okay, now we'll talk about the articular disc in the next video.